My name is Dr. Penny Breeze. I'm an SPHR Post-doctoral Launching Fellow, and I'm a health economist from the University of Sheffield. I want to talk today about two projects I've been working on with SPHR and how these are developing my future research ideas. First project develops from existing work we've been doing on obesity and diabetes prevention modelling and aims to extend this model to include a systematic framework for evaluating food policies. The structure of the model takes a change in food policy, such as food advertising, and looks at how consumer behaviour will impact on dietary composition and how this diet then translates into changes in metabolic risks and long-term health impacts. We've been developing policy scenarios with stakeholders and we'll be looking at patterns of response to changes in policy by looking at changes in target products, also substitution between products, and how these patterns might differ between socioeconomic groups. Another area of research is to look at how diet impacts health by looking at how energy intake relates to BMI and macronutrients relate to other metabolic risks such as blood pressure, cholesterol, and glycemia. From this work, we hope that we'll be able to take hypothesized food advertising policies and look at the long-term impacts on diabetes, cardiovascular disease, mortality, quality of life, healthcare costs, labour outcomes, and look at how these outcomes are distributed between socioeconomic groups. Another area of research is to develop a guidance document for complex systems computational models. The aims are to agree on a definition of complex systems computational models and also develop a guide to help researchers plan and execute this type of modelling. The audience is quite broad, so we hope to benefit public health researchers, commissioners, and modellers with varying levels of experience. The process brought together 45 academics with a broad range of experience in complex systems, public health, and related disciplines across 2 workshops to agree the guidance content. In the future, I really hope to develop a complex food systems model. The aim would be to identify mechanisms that drive population level changes in diet and also to provide decision support for food policies. The project would aim to extend our existing food policy models to incorporate the wider determinants of the food system and also the wider impacts of the food system, to consider interactions and feedback loops and see how these properties lead to emergent outcomes in the population. Thank you.